To the urgent headline tonight from the World Health Organization, sounding the alarm, holding emergency meetings after the deadliest outbreak of Ebola on record. This new outbreak now killing more than 460 people across 3 African countries. ABC's chief medical editor, Dr. Richard Besser, who has studied this up close on the new fears tonight and whether this deadly disease could travel here.
We saw the deadly power of Ebola firsthand in Uganda. A disease so dangerous, anyone going on the ward took extreme precautions.
There's not one speck of my body that is exposed. Making sure that every inch is covered is absolutely essential.
To date, the World Health Organization is struggling to contain this unprecedented outbreak, spreading in part from trade across the borders of 3 African countries, Liberia, Guinea, and Sierra Leone. There is no cure. In this outbreak, 62% of infected people have died. Ebola only spreads by close contact with body fluids of infected people. When I visited this ward in 2012, whenever the team touched a patient, they were quickly sprayed down with disinfectant.
I have to say that there are few things that I've done in medicine that are as nerve-wracking as going into this place.
Tonight, a new fear. Some frightened patients staying away from hospitals and further spreading the disease.
The numbers are just stunning. Dr. Besser is with us now, and we've seen this spread across 3 countries in Africa. A lot of people wondering, could it come here?
You know, it's very slight risk. You only spread this disease when you're very sick with symptoms, and in that condition, they would never let you on an airplane. But it is possible for a healthcare worker who's incubating this infection to travel here. And while it wouldn't spread around the U.S., it's why it's a worldwide problem tonight.
Yeah, that possibility, why we should all pay attention. Rich.
The virus gets into the body through cuts and scrapes on the skin or through mucosal membranes in places like the eyes, mouth, nose and throat, or through jabs from contaminated needles. Once inside, the virus quickly infects immune cells in the body known as monocytes, macrophages and dendritic cells. These spread the infection around the body through the bloodstream and probably the lymphatic system as well. The incubation period of the virus is 2 to 21 days. Then people start to show extreme flu-like symptoms, a sudden onset of fever, chills, muscle pain, alongside diarrhea, nausea and vomiting. Easily confused with other more common African diseases such as malaria, typhoid and Lassa fever. Because of this, at the start of an outbreak, patients are often misdiagnosed.
Thank you.
Ebola is a frightening virus, that's for sure. So it's understandable why there's widespread anxiety. But there's also been some illogical panic. Here are some things to help put the handful of Ebola cases diagnosed in America in perspective. Ebola is spread by direct contact with body fluids. It is not spread through the air the way influenza is. If it were, there would be millions of cases of Ebola throughout Africa, just as there are tens of millions of flu cases in this country every year. Patients with Ebola are not infectious until they have symptoms. Every single Ebola outbreak in Africa over the past 40 years has been brought under control with standard public health measures, basically isolating infected patients and tracking down their contacts. Ebola has a mortality rate of about 70% in the epidemic in West Africa. But as a colleague of mine has said, it has never before collided with modern medicine. Although no drug has been proven effective yet, treatments such as intravenous fluids to correct severe dehydration will likely dramatically improve outcome. So far, there has been 1 death among 8 patients treated in America. It's a near certainty more individual cases will continue to reach other countries until the epidemic in Africa is controlled. But individual cases will not lead to widespread outbreaks if healthcare workers make diagnoses quickly and the correct protocols are followed. This will protect healthcare workers from Ebola, as we've seen at special centers such as Emory in Nebraska, where no Ebola patient has died and no healthcare worker has gotten infected. Still, people are understandably nervous. Significant mistakes were made after Thomas Eric Duncan traveled from Liberia and showed up at a Dallas hospital with Ebola. And it's clear not every hospital in America is prepared to deal with the virus. That's why future patients will likely be transferred to specialized treatment centers, just as was done last week with the 2 nurses infected by Mr. Duncan. And medical centers across the country aren't assuming they're more prepared than the hospital in Dallas was. That's why they're practicing what to do if an infected patient walks into their emergency room. One thing's for sure, there will be a learning curve, and mistakes can never be totally eliminated. But if we keep finger pointing to a minimum and learn from our mistakes, we will get Ebola under control in the United States. And as we battle the relatively small number of cases here, we have to understand the single most effective step our country can take to eliminate the threat in America is to help wipe Ebola out in West Africa.